What is continuum of care? That means that you might be able to, well, call Elizabeth, you might be able to find a place, a long-term care facility. They have different levels of care. I'm not recommending, okay? I'm going to give you examples, okay? The examples would be, have you heard of Friendship Village? There's one location in Chesterfield. There's one location in South County in Sunset. Have you heard of Lutheran Senior Services, Merrimack Bluffs? Lutheran Senior Services, Laclede Groves. Have you heard of those? Okay. So, have you heard of Delmar Gardens? Okay. Have you heard of Cardinal Ritters? Okay. So, those are big nursing home companies. They might be for-profit. They might be non-profit. Okay? Either way, doesn't matter. So, because the charge, don't think that you go to a non-profit, Lutheran Senior Services. Don't think that you go to Lutheran Cardinal Ritters, then it's necessarily gonna be very little charges. No, not necessarily, because Lutheran Senior Services, Merrimack Bluffs or Laclede Groves, it is like $5,000, $8,000 a month. Okay, it is just as bad or as expensive as for-profit. Okay, so it doesn't matter to all of us in terms of money. Okay, so what is continuum of care? So those companies that I just talked about, so they are huge. They have huge campus, and then on this very same campus, they have different levels of care, or even within same building. Okay, so grandmom, when first moved into assisted living in this facility, grandmom cannot. Grandmom can still walk by herself. Doesn't need a whole lot of changing, showering, whatever assistance for those things. But now, grandmom has graduated from assisted living, and grandmom has moved on to skilled nursing, higher level, right? So it might be within the same campus, even within the same building. So grandmom can actually still go to see her old buddies, no problem there. So that's you have different levels of care very closely put together, and that's called continuum of care. So would it be easier if you are looking for a long-term care for grandmom, and then grandmom doesn't have to move again, right? Because grandmom will be in the same campus, the same building, right? That's called continuum of care. And if you want to know what those are, what those companies are, call Elizabeth, and she'll give you a list. Okay, so who needs long-term care? People who cannot be independent. And what that means, you need to consider two things. One is safety. The other one is liability. What is safety? Well, I'm worried about grandmom, because grandmom, in daytime, we have home health care to come in. In daytime, we can go visit. But how about between 8 o'clock at night all the way to 8 o'clock in the morning? Can grandmom survive those 12 hours? I don't know. That's the question that keeps me up at night. Because grandmom gets up, and then grandmom gets on the toilet at 2 o'clock in the morning, and then cannot get back out. And so then what? Then grandmom is stuck on that toilet all the way till 8 hours later, 10 hours later. That is the safety issue. What is the liability issue? Liability is that, well, grandmom thinks that she can still drive. Grandmom thinks that she can still cook. Don't think that, grandmom can still drive, and then grandmom just has a little bit of bump there, has a little bit of fender bender there, right? Well, that is if grandmom doesn't kill other people, other passengers, okay? Other people who drive, who who are walking on the street, who are driving their own cars on the street. Then how about cooking? Well, grandmom starts cooking, right? And then pick up the phone because the daughter calls. Hey mom, how you doing? Whatever. Okay, then 2 minutes later, grandmom put down the phone. What happens? Grandmom forgot that she's cooking on the stove, and then moved on. Why don't I just go take a nap? And now the entire house, the entire building is gonna burn down. That's the safety issue. Okay, so you need to think about if this person can be still independently living their own life in terms of 1, safety, in terms of 2, liability. Because you hurt yourself, that's on you. You hurt other people, I hope you have enough money to pay, right? But we are not gonna have all that money to pay other people because we need that money for long-term care for ourselves. Okay. Pricing, I talked about that. Medicaid, Medicare, I will talk about that in a bit. Okay. So hospice can happen in all different levels of care, all of them. Okay. And now you're gonna ask me, well, you just said that if grandmom cannot navigate herself out of the building within 5 minutes, then grandmom cannot qualify to live in assisted living. And then what if grandmom is bed bound? Can grandmom still do hospice in wherever she is? Well, yes and no. If grandmom has lived in this facility, this assisted living, for the past 6 months, a year, 3 years, whatever, and now grandmom is diagnosed with something terminal, and then grandmom is gonna be on hospice, then yes, grandmom can be here till the end. However, if grandmom's been in her own condo, in her own apartment, in her own house, and now grandmom is diagnosed with something terminal, and then grandmom is gonna be bedbound soon to be on hospice, can grandmom go, well, now I'm gonna move into this assisted living to be on hospice there? No, because if you want to freshly move into an assisted living, you need to qualify that 5-minute thing. So decisions. From the left, that is your independent living. You need to think about, well, let's look at what those pictures are. Oh, well, you need to think about cooking. You need to think about doing your laundry. You need to think about your grocery. You need to think about, cleaning. And then there are also other things. How about doctor's appointments? How about picking up drugs? Okay? How about attend to your doctor's appointments? Those are the things that you need to think about if you are considering still living by yourself, independent living. Okay? And then in-home care, that is when independent living is not gonna work smoothly. Then in-home care, you can look into in-home care options and then have them come into the house, say 4 hours a day, 7 days a week. If that's good enough, then great. However, in-home care, is that doable or not? That also depends on, 4 hours a day, 7 days a week. How about the other 20 hours a day? Can grandmom survive through those 20 hours? Do you wake up at night thinking about grandma might be on the floor, cannot get up? If that's the case, then that's a safety issue right there. Do you think about grandma might be cooking and then forgot, and then taking a nap? If those questions keep you up at night, maybe time to think about to live in a facility. Okay, and then we talked about the facility, right? Okay, so I'm gonna jump to my last thing here, your Medicaid and Medicare here. Okay, so Medicare, Medicaid, right? I'm gonna divide this for you, and it's gonna be easy for you to understand. Okay, Medicare, C-A-R-E. Medicare is a federal program. The entire country is the same. Medicare. Okay? Are we good? Medicaid, C-A-I-D, Medicaid is a state program. Every state is different. Every state has to have their own Medicaid. Every state runs it a little bit different. Okay? So for Missouri, our Medicaid is called Mo Health Net. Mo Health Net. Okay, 2 words. Mo, M-O, that's Missouri. Health Net, that's 1 word. Okay? So Mo Health Net. So federal, Medicare, state, Medicaid. We good? Okay, next thing. Medicare, C-A-R-E, it is an age-based program. Age-based. What is that? That means as long as you are 65, you qualify to have Medicare. Age-based. Medicaid, C-A-I-D, that is a income-based. In fact, let me rephrase it. That is an asset value-based program. Okay? What does that mean? That means that you have to have limited assets, limited income in order to qualify to have Medicaid. It does not matter how old you are. Okay? Income or asset based. Okay? And that is $5,000 for one person. Okay? So, that means that if you have assets, the total value of your assets, except for a house and a car. You can have a house, doesn't matter. You can have a car, it doesn't matter. Doesn't matter to Medicaid. You can still qualify, okay? But you cannot have, well, I want to have a house, I want to have a piece of land, and I want to have a summer cabin. No, just one house. You cannot have a car and a boat and maybe an airplane and then a horse. No, just one car, okay? A house and a car are not included towards your asset limits, that $5,000 to qualify to have Medicaid. Okay? Now, Medicaid, however, when you are applying, right? Okay, now, well, Will is standing right there. Will looks like a nice guy. And in fact, Will and I, we are best buds. We've been knowing each other for the past, 50 years, right? So now, I'm thinking that, well, I need to go into long-term care. But you know what? I worked my ass off. I saved all these money, these $3 million that I saved, right? I don't want to use all of them on my long-term care. I don't want to pay my long-term care with my hard-earned money, right? So what do? I'm thinking, well, guess what? I'm gonna transfer all my $3 million to Will. I'm gonna have him guard my money for me. Isn't that smart? Yeah. So then I can then qualify to have Medicaid, right? And the state is gonna pay for me living in a long-term care. Isn't that great? Well, I transferred all of my money to Will in 2020. And 2023, right now, I'm starting to apply to Medicaid. Guess what? Medicaid has federally granted power. It's called a 5-year look-back period. And they can actually look into my bank account, and then they're gonna go, hey, Chien, 3 years ago, you transferred $3 million to Will, and now we're gonna need you to provide a reason. And if I cannot convince them, guess what? I'm not going to a nursing home. I'm actually going to jail. Okay? So keep in mind, 5-year look-back period. So don't try to play tricks with the government. Okay? So now, keep going. Medicare pays for your short-term rehab. Short-term rehab. How short is short-term? 100 days. 100 days. Grandmom broke her hips, her femur bones, and whatever, and then got knee replacement and whatnot. And now grandmom needs what? Needs PT, physical therapy, OT, occupational therapy, and then grandmom gets to be in a rehab facility for up to 100 days, paid by Medicare. Okay? Now, do you actually get 100 days? No. So our study from last year, you get about 3 weeks to 5 weeks. And that's it. That's not 100 days. Okay? Why? Because Medicare, they are losing a lot of money. Okay? It's a huge black hole. Okay? And so Medicare is trying everything to kick people out of the program, the rehab. Okay, therefore, grandmom has been in the rehab for 2 weeks, right? And then all of a sudden got a letter from Medicare saying that they are terminating grandmom's Medicare coverage. Why? Because, well, we've observed the physical therapist report 2 weeks in a row, and we realized that grandmom is not making any progress, can no longer be rehabbed. That rehab is not going anywhere. Therefore, grandmom has hit the plateau. Once grandmom's hit that plateau, Medicare is gonna kick grandmom out of that coverage. Okay, so no one gets 100 days. Okay, but there are ways to deal with that. For example, when you get that discharge letter from Medicare, which unfortunately it only requires 48 hours. Okay, they can give you that discharge letter on Thursday and want you to get out of here by Saturday. So 48 hours. Okay, so once you get that discharge letter, your first thing is to appeal. They have to give you that discharge letter. On the discharge letter, there will be a Medicare appeal number. Call them, appeal. That's one thing. Secondly, talk to the facility to see if we could transfer grandmom into a long-term living in the facility paid by state Medicaid. Okay, that's your second option. So now let's go to Medicaid. Medicare pays for your short-term rehab. Medicaid, that is if you qualify, pays for your long-term living in the facility. Okay? Now, so isn't that great that the Missouri state is going to pay for me to live in the facility? So then I get to have all of my money, my monthly income, my Social Security, my pension, my stipend, my whatever, my retirement. I get to keep all of those. Well, not exactly. So what happens is this. So in a long-term care facility, there are two kinds of charges. Okay, two kinds of billing. One, that is medical-related services they provide to you. Okay, that is covered or paid for by Medicaid. Medicaid is going to pay for medical-related services, treatment that you receive in a facility. Okay, Medicaid. Well, but there are things that are non-medical that are happening in the facility. What are those? For example, someone's got to cook 3 meals for you. Someone's got to mop your floors. Someone's got to do your laundry. Someone's got to scrub your toilet, right? Those are not medical-related services that are provided to you, okay? Who is going to pay for that? Not Medicaid. So you are going to pay for that out of your own pocket, okay? Now, Will, he's been working his ass off in his entire life and whatnot, and now every month he's got really good Social Security. Every month his Social Security is $3,000. Isn't that great? Okay, now me, I've been slacking my entire life, right? And then I'm not really making that much money, so I don't have that much saving either. And then every month, my Social Security is $1,000. So he's got 3,000, I got 1,000. Okay, but guess what? When we are roommates in this skilled nursing facility, the skilled nursing facility legally they can take his entire check, $3,000, to cover those non-medical related services. They can take his entire check except for $50. They are going to take my entire $1,000 check, leave me $50. So doesn't matter. He worked his entire life so hard and whatnot. At the end, each one of us is going to get $50. Isn't that equal? Well, it's equal because $50 equal $50, right? It's so not fair, right? However, that is how it goes. Medicaid, in order to qualify to have Medicaid, I know a lot of us, we might have life insurance, right? And then a lot of us, we might also already have a burial plan, prepaid burial plan, okay? And you might have a long-term care insurance too, right? Now, keep in mind, those insurances, those different kind of programs, you have to go back tonight to look at your contract with those insurance companies. You need to make sure they are not revocable. I'm going to say that one more time. You need to make sure they are not revocable. What is revocable? Revocable means that, well, I've been paying for my life insurance. I've been paying for my burial plan, right? And then it's the value of say $10,000, right? And then tomorrow morning I get up, I just feel like, well, I'm not doing this crap anymore. I'm just gonna cash out. I'm gonna take all the money out. If they allow you to cash out anytime you want, there are a lot of insurance policies are like that, okay? If they allow you to cash out, you might lose a little bit. Yeah, but they allow you to cash out. That's called revocable. When your insurance policy is revocable, that's considered your assets. And by assets, let's talk about the $5,000 limit for Medicaid. If your life insurance that you can cash out, you can terminate and get the money out right away anytime you want. If that's considered your assets, let's say if your life insurance, it is the value of $20,000. Now, that's revocable. That's considered your assets, and it's $20,000. Then you are gonna disqualify to have Medicaid. So make sure your insurance, your life insurance, your prepaid burial plan, your long-term care insurance, they are irrevocable.